Hello again, everyone. This is Dr. Dan Bockmann. Today we're answering questions again. Actually, I'm just going to bring up something that I've noticed in clinical practice in my rehab work. I want to talk about the two most commonly nagging injuries. By nagging, you guys already know what that means. But nagging, it's not a medical term, but it means injuries that are famous for taking a long time to heal or resolve. It seems like it's taking forever, or maybe it's improving, but it's just barely, the pain's barely coming down as time goes by. Or maybe it's a nagging injury because it keeps coming back over and over, and it feels like it just started to get better, and then you went back and played tennis, and then it came back again. So the number one is most nagging injury. Well, they're basically a tie, but the first one we'll talk about is tennis elbow. Pain on the outside of your elbow, hurts to open a jar, shake hands, open a door, use a screwdriver, and it can be excruciating. I mean, patients will tell me that I just can't use that hand. I'm trying to use my other hand for all these things. And that's also known, tennis elbow is also known as lateral epicondylitis, which the itis on the end of that word means inflammation of. So it just means inflammation of the tendons where they attach to the outer part of your elbow. You can also have medial epicondylitis, by the way, which is also known as golfer's elbow. Much less common, but it can still happen. You don't have to play tennis or golf to have these things, by the way. But they're famous for being excruciating. And I went and got treatment. I got injections in there, steroid injections. I got massage. I tried all these things, none of them helped, or they just barely help. And then as soon as I try to use it again, it hurts. Now the number two most commonly nagging injury is plantar fasciitis. So this is just heel pain, and it typically presents as the first few steps out of bed on a hard floor in the morning are excruciating. I feel like I want to walk on my tiptoes. Or it feels okay unless I wear really comfortable shoes, but famous for runners get this a lot, anyone who does run jump activities, but you don't have to be a runner to get this either. In fact, someone who has an ankle sprain and they're in a boot and their foot's immobilized for 4 weeks or whatever, often, even though their heel was fine when they got the ankle sprain, when they come out of the boot, they've got plantar fasciitis as well. Again, famous injections don't seem to work or give temporary relief, but the pain comes back. By the way, anti-inflammatories like Advil, ibuprofen, Aleve almost never make a difference for either of these issues. You'll take it, and it just doesn't really even seem to take the edge off. So, tennis elbow, plantar fasciitis. Now, I will say this about both of these. We routinely get great results with these in practice. But the thing about them is, yes, they're hard. They often come back unless you give your body exactly what it needs to recover from these things. So, and those things aren't complicated, and they're usually almost never surgical and rarely need meds at all, and certainly not injections to get the results. But it has to be precisely followed, this treatment plan that I give it. If you leave out one of the elements, then expect it to really not respond. So when I have patients who have these conditions, I throw all the things that I know could possibly help them at once at them at the same time, and then force them to be rigorous on it. Now, when you're coming back after an injury of these kinds, the way you come back is key as well, as with coming back after any injury. But the key is finding a safe entry point into the sport or the exercise, the activity that you'd cut out. Super easy, safe entry point, and then gradually increase intensity so that these parts have a chance to adapt to that workload again by getting stronger, and then they're able to do it at each new incremental increase. So they're famously nagging injuries, but there are fixes, and they're pretty straightforward, and they don't have to be that complicated or expensive. Hope that's been helpful. If it has, subscribe below, share it. If you have a question of your own you'd like me to answer, leave that in the comment section below, and I will try to get to that with a video answer at some point in the future. Thanks again. See you guys next time.